I was lucky to get my psychiatric treatment from teachers who practiced psychiatry in the 60s and the 70s, before the 80s, before the DSM was invented. Because these teachers, they taught us psychiatry from the phenomenology point of view. What is phenomenology? Phenomenology are signs and symptoms. Symptoms are the complaints of the patients, and signs is the observation of the clinician. In those days, the DSM did not exist. We actually learned the phenomenology of all mental disorders, how they are expressed in reality, and we tapped into the experience of many, many years of clinicians who described the mental disorders. So the phenomenology would be the signs and symptoms over time, so you get the story of the patient over time, and you also get things that are not directly related maybe to the patient, but to the circumstances. For example, patients who don't have insight, like psychotic patients or demented patients, they would probably come to the clinic with a family or someone accompanying them. They wouldn't initiate a visit to the psychiatrist. So even the setting in which the clinician encounters the patient is described in the phenomenology. Now, when the DSM came out, the phenomenology was less taught. And Nancy Andreasson has a lecture titled The Death of Phenomenology in American Psychiatry. It turned the description of the patient to a shallow list of statements, and the phenomenology was not taught in depth anymore and was not acquired by professionals. This has caused the level of the profession to go down, and for many years I encountered this deterioration, and I always encounter this saying that you think that you touched rock bottom, but then you hear someone knocking from beneath, meaning that it could be worse, and it's becoming worse and worse. So I think one of the things that psychiatrists in the future will have to do is go back, in some sense, to be more experts in the phenomenology. Once you become experts in the phenomenology, then you can go ahead and begin to match to this phenomenology knowledge from computational neuroscience and advanced neuroscience, in order to begin and discover the correlations of what could be the basis, the origin, the etiology of mental disorders.